And welcome back. It's about 25 minutes past the top of the hour. I had introduced Harry Kimtai, the Principal Secretary, Medical Services, PS. Thank you so much for coming tonight.
Thank you.
A lot has been said about SHA and SHIF. And tonight we want to take stock of what has been happening in the last month, the challenges, the lessons, and the opportunities we have with SHA. Your overview of the implementation of this system that some Kenyans believe was rushed and not well thought about. PS.
Thank you. You want to mention here that the implementation of the Social Health Authority and specifically the system was not rushed. We had developed the system for quite a while. We had also done tests, what's called the lab tests, and we agreed because it was announced by the Cabinet Secretary that 1st of October will be the launch, or not even the launch, the rollout of the social health insurance treatment plan for the country will start on that 1st.
Yeah.
And indeed, we started on that 1st. However, because all the facilities were trying to register at the same time to get the logins which we had given them, there was a challenge of the system, and we had some challenges which we addressed them immediately. In the meantime, what we did is we agreed with the facility owners that they should not return the patients. They should continue treating the patients with an alternative. One, the previous system of NHIF was still functional because we still had some patients who are in the hospital. So we had advised them that in the event the system fails, then revert back to the NHIF system.
But is that what happened?
Confirm if they have paid up members of NHIF. Okay. Because we had other patients who had their hospital bookings had been done, and they should not be stopped from getting treatment.
But did that really happen? Did the hospitals treat people? Did they not send some home? Because there were issues, PS, of money that NHIF owed to some of these facilities. And then there is this transition of the system, which was largely resisted by some quarters and some stakeholders you have. Did that really happen? Because we had a lot of complaints.
What happened is the facility owners, specifically the private ones, had challenges and they did not understand how are they going to claim. Some of them had not uploaded the new tariffs, the Social Health Authority tariffs into their system, and therefore they were like kind of, they didn't know how they are going to claim, they didn't know what are the rates, what are the tariffs that the patient is entitled to.
Okay.
And therefore what they did is they demanded for upfront, cash payments upfront.
Out-of-pocket payments.
Out-of-pocket payments.
Yes.
And those who did not have the money, they are not prepared, they are not carrying the money, some of them returned back home with the complaints that we had booked the appointment, we had paid our NHIF, yet we are not able to get service. That is where the confusion came in. But immediately we notified the facilities because we had told them that even if we have not been, we've not been signed the contract, we had given them the leeway to proceed and offer service within the starting date of 1st.
Okay.
So it was a confusion where the facilities did not know, and they said, since you're not sure,
we are not going to do it. But yes. It's been 30 days. What is the progress on this? In 30 days, did you correct it? Because a lot of questions around how could a solid system that cost 104B fail during registration? I just saw your eyes roll, PS. 104B.
When you say a system that costed 104B, that is not the truth.
What is the truth?
The truth is that this system has different components, which adds up to that 104.
Okay.
There's training component, there's a lot of things within that system. So when you say a system, I think you'll be misleading. So let me say this.
Yes.
That everybody, most of the facilities had been notified. We had sent the messages, we had communicated to them. There was that challenge, and we've now come to realize what was really the issue. The issue was not about the system. The issue was outstanding payments, which the government owed the facilities. So when we engage with them, it says, can you confirm that you'll even pay to us the outstanding payments? And we have given them the assurance.
Then they again engage.
Yeah, they
After
engaged.
that confirmation.
After that confirmation, they engaged. We called them and asked them what are really the challenges. So they came forward and we engaged. So we assured them that we shall start paying your outstanding debts under the NHIF. And therefore, that's why when you are giving us statistics,
Yes.
at the start of the show, you saw the number of facilities which have now registered and contracted. So the number went up, and they said, if that is the case, we now know. And then we told them to upload the tariff so that when they are treating the patients, they are treating the patients under the new tariffs of Social Health Authority.
Could you bring the graphics up for the facilities that have enrolled? If you find them, I think we started with 4,444, if I'm not wrong. But PS, touching on the same enrollment, why is it that you did not engage beforehand so that there was no problem with these facilities? Why is it that you are engaging post the act, post the rollout? How comes you didn't do it before?
They had been notified by the management of Social Health Authority that the new system will be operational effective 1st of. So they kept quiet. We knew that we had communicated to them. We had told them what to do. So according to us, everybody was ready to start treatment under the new Social Health Authority.
Okay.
However, that's the challenge that we faced is when we realized that there could be something beyond. Beyond the system and beyond what we are starting. So that is when we now engage them.
Okay.
Yes.
The question that a lot of Kenyans are asking, that is the statistics for the facilities that have been enrolled. Yes. But one of the difficulty, again, that was with the system is the enrollments, the passwords, the logins that were rejected. In fact, a day later, I remember there are so many SMSs that came to people's phones notifying them of that migration. Now, the question is, why couldn't the ministry just decide to use the old system and name it as SHA? Or national, or SHIF, that is.
There was no way we were going to use the old system and name it the SHA system. We were doing away with the system that was being used by NHIF and starting SHA with a new system. And therefore, we had to take that route. So the issues of the login challenges were sent to the facility users, and they had been trained. I think the training that took place, some of them did not understand on what to do, because we did a lot of virtual training to all the facility users. They gave us their contact persons. We trained them virtually. We showed them how to do the logins, but they had challenges. What we did now is we had to send officers to almost each and every facility so that they are trained and given.
How many facilities in total?
That's the figure that you have there.
Okay.
Yes.
In total, there could be about 16,000?
The total number of facilities and panel by KMPDC is about, right now it's about 13,000.
So you sent to
So we did not send to all the facilities. We sent to the ones who had given the initial, we gave them the initial contracts. Basically, the first ones we started were the ones who are providing services under the previous NHIF.
Okay.
And therefore, we knew that the patients who will go there are patients who are under NHIF. So those are the facilities that we gave priority.
Okay. You have said that there's a 30% enrollment, and you say this is something good. From 9 million to 13 million. That's an increase of about 4 million new users. Yes. Noting that the 9 million are users who are already existing on the NHIF platform, how is this a good thing that in a month the total statistics of new enrollments are only 4 million PS?
If you look at the statistics and you look at the figure of 4 million, before NHIF, I want to tell you this, before NHIF, NHIF used to have about 12 million users.
12 million in total?
In NHIF.
Yes.
Before. So what we did is we changed the approach in the sense that we wanted to verify these NHIF registered members, because we realized that part of it could be fraud on those members. So what we did is we changed the procedure and used what's called the National Registration Bureau, the data of the National Registration Bureau. We verified the biometrics of all those 12 million users against the National Registration Bureau. And the figure that came out was that only 9 million were truly identified using that system.
Okay.
So 3 million, first and foremost, was clean data from, was data that was, we cleaned that data and showed us that 3 million could be fake.
Okay.
So that was put aside.
Okay.
We transitioned 9 million.
Okay.
Of these 9 million, now you can see we are at 13 million. So within this short period, 4 million Kenyans have registered, meaning that the number is going to increase. And I want to tell you this, every day, like yesterday, 91 million Kenyans registered.
91?
I mean, not 91 million, 91,000 Kenyans registered.
91,000, okay.
Yeah.
Okay.
So you can
in
see
a single day?
In a single day.
Okay.
So you can see as Kenyans get aware that this new treatment now is better than NHIF, then more are enrolling into the new system.
Okay.
So we are impressed with the way Kenyans are coming out to register, and we are urging them to continue registering because there is no deadline for registering. What we want is that any day, anytime, we want more Kenyans to register because there is social health insurance for all Kenyans.
When we come back, we'll be explaining exactly how this is a social health scheme and the benefits. We will be assessing in 1 month, have they achieved exactly what they set out for? And what are the challenges from where the PS sits in the implementation of this system? And we'll also be interrogating the opportunities that are now available, now that they have tried, tested, and of course, tasted this system. Stay with us. We are back after the break.